This video demonstrates the application and removal of personal protective equipment, PPE, to be worn to prevent transmission via aerosols from the respiratory tract of an individual or when undertaking aerosol generating procedures, AGPs. These precautions may be applied with COVID-19 but also with transmissible infections such as influenza or tuberculosis. For aerosol generating procedures, have the recommended personal protective equipment PPE and a fit tested FFP3 mask. You may require a buddy to assist you in the application of the PPE and to perform a final check before you enter the room or cohort area. Perform hand hygiene before putting on the PPE, and if glasses are worn, remove them before putting on the FFP3 mask and replace them before you put on the visor or goggles. Put on the FFP3 mask. This must be the mask that you've been fit tested to use. Position this upper strap on the crown of your head above the ears and the lower strap at the nape of the neck. Check for fit by placing your hands over the valve of the mask and taking 2 sharp intakes of breath. You should feel the mask come in towards your face. When you're satisfied of the fit, next put on your theatre hat. It should cover the hair and your ears and tuck any loose straps into the hat. Next, put on your visor or goggles. The visor should be down on your forehead and cover your face fully. Next, put on your long sleeve fluid repellent gown. You may require a buddy to tie the ties at the back. Make sure it is comfortably tight at the neck and tight around the waist sides. Next, put on your gloves, and your buddy can assist you with this. Hold the gown with your thumb, and that will ensure that the sleeve of the gown goes well down into the cuff of the gloves. If the procedure is highly contaminating, you may wish to add a white plastic apron to be worn over the gown. The buddy completes a 360-degree check, checking that the PPE is satisfactory and that the hat is covering the hair and ears. If satisfactory, you may now enter the room. Removal of PPE in the defined systematic manner and the assistance of a buddy will minimise potential self-contamination. If you require assistance to loosen the ties of the gown, indicate to your buddy that you are ready to remove PPE. The buddy loosens ties of the gown through a small gap of the open door. Close the door and remove gown and gloves in the room, crossing arms over, peeling the gown down the arms, removing gloves within the gown. Avoid touching the outside of the gown as it is contaminated. Dispose into the clinical waste bin. Wash your hands following the 7-step technique before leaving the room. At the time of a pandemic or outbreak, staff must follow current and up-to-date guidance that may suggest that facial protection can be used sessionally. However, apron, gown, gloves must be changed between patients. Decontaminate your hands following the 7-step technique. If the visor is very contaminated, you may wish to put on clean gloves. Remove your visor by stand up straight, lift the elastic strap at the back of the head and lift strap upwards and over the head using both hands. Place into the clinical waist bin. Pinch the front of your theatre hat and slip off backwards and dispose into clinical waste bin. Decontaminate your hands again. Remove your FFP3 mask. Carefully and slowly, do not touch the front of the mask. Loosen the straps at the side of the mask and remove away from the face and place into the clinical waste bin. There may be other types of FFP3 masks that are removed by reaching to the back of the head with both hands. Carefully and slowly lift the bottom strap up to meet the top strap and bring both straps over the head. Carefully remove the mask away from your face and drop into the clinical waste bin. Now that all PPE is removed, immediately wash your hands with soap and water, following the 7-step technique.